Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. Doctors change lives every day, but what happens when life changes yours? A single injury, a sudden illness, your career, your income, your future can shift in an instant. The best physicians don't just plan for success, they protect it. At Set for Life Insurance, they believe financial security isn't a luxury, it's a necessity. True own occupation disability insurance ensures that no matter what happens, your future stays in your hands. Because protecting your income means protecting everything you've built. Visit drpodcastnetwork.co/set4life today. Secure your future before life makes the choice for you. Today we have the opportunity to have Dr. Brett Cordes with us on the podcast. Brett has an interesting and unique story, and I really appreciate his willingness to share. Brett has practiced as a really successful otolaryngologist for over 10 years, had a really great clinical career, but unfortunately had the diagnosis of opiate addiction, which came to light. Obviously, it was kind of a personal crisis for him, and he found his way back to medicine and back to coaching, and has been able to try to be a force for good in the medical community and just among our whole nation. And so I really appreciate Brett being willing to come on the program today. I hope you'll find this story as interesting as I do. So, Brett, welcome to the program. Would you mind introducing yourself?
Absolutely. Yeah. My name is Brett Cordes, as you said, and I'm just really excited to be here. Looking forward to it.
Awesome. Well, it's a beautiful spring day. We were talking before we started. Brett's already been out playing disc golf this morning, getting ready to go, living that active life. I love that.
That's right. Yeah. And like we were talking, it's a lot easier to be decent at disc golf than it is at ball golf.
Yeah, no doubt. No doubt. Yeah,
and cheaper too.
Way cheaper. Yeah, you can go all over the world and play ball golf. That's a lot of money, but disc golf is usually an inside crowd. That's pretty fun.
Yeah. Yep.
Well, so talk me through just as kind of introduction to yourself. Just kind of walk through, how did you get into medicine? What made you choose medical school, and specifically otolaryngology? And just kind of talk us through the early years of Brett Cordes. How did you do that, and how did you end up specifically in your specialty?
Sure. Well, I was born and raised in Baton Rouge, Louisiana. My dad was a mathematics professor at LSU. And my mom was an English instructor also at LSU. And my sister is 10 years older than me. So when I was 8 years old, she was 18. She had already graduated high school, moved out of state for college. And then she attended law school and went and worked in New York City. So I was functionally an only child by the time I was 8 years old.
Yeah, that's a big gap.
Yeah, 10 years is a big gap. And we're not all that close just because of that reason alone. But I grew up in a heavily academic household. Academics were really made the top priority. As I said, my dad was a professor of mathematics at the college level, my mom English. My sister was salutatorian of her high school, and she went on to be an attorney in New York City. So at a very young age, I had excellence modeled for me. And unfortunately, as a kid, I kind of adopted that as a motivation for self-worth and self-love, and also just actual love for my parents. I kind of misinterpreted their modeling of excellence in that I felt like if I wasn't the best, certainly I had to do my best, but really I had to be the best or always excel for me to receive acceptance and love from my parents. And this is despite the fact that they never openly or overtly pressured me to get all A's or, you have to perform. It was nothing like that. It was all just kind of a misinterpretation on my part. But nevertheless, my self-love by the time I was 8, 9, 10 years old was tied to my achievements or my accolades or my performance in some way. And so I mention that now because later on in my story, when the addiction comes into play, that will be kind of front and center. But I had a good normal upbringing, I would say. Went to high school in Baton Rouge, went to college at LSU, majored in history. of all things. And then eventually went to medical school in New Orleans and then on to train for ENT in Houston, Texas. But um, by the time I was a freshman in college, I had no idea whatsoever what I wanted to do with my life. I majored in history simply because I enjoyed history, but I mean, I had no idea. There were no healthcare workers in the family, no doctors, no nurses, no therapists. We were all academicians and attorneys. But in April of my freshman year, so this is the tail end of my freshman year, I have a 4.0 grade point average, but I still don't know what I'm going to do. I was diagnosed with non-Hodgkin's lymphoma,
Mm.
which was a total shock. I mean, I had B-type symptoms for about a week, but other than that, it was a complete shock to me and my family, obviously. And to make a long story short, my cancer battle lasted 16 months because I had standard CHOP chemotherapy for the first 4.5 months, but then the disease recurred about halfway through my radiation. It was stage 2 originally. Um, and then I had to got a second opinion at MD Anderson, and eventually that treatment protocol culminated in a stem cell transplant um, at MD Anderson in Houston in January of
Man,
1997.
that's a big deal. Stem cell transplants. That must have been crazy to go through that at that young age.
Yeah, at that young, and in 1997. I mean, it was not. It was, if I remember correctly, it was a clinical trial. They had done stem cell transplants previous to that, but they had not really been doing autologous stem cell transplants. So I was really in that first batch of patients to receive that specific treatment. But yeah, it was a challenge to say the least. But
Wow.
one silver lining that came out of it, and honestly, there were many silver linings, but it made me want to be a doctor. You know,
Mm.
I had seen the other side of the doctor-patient relationship up until that point, and I felt like there were some pros and cons and some advantages and disadvantages of being a physician. But I thought that there were well more advantages than not. And so that experience, I switched, stayed my major state as history, and I took the appropriate classes and went to medical school and became a doctor because of that experience.
Wow. Just a little bit of a sidebar. That is interesting because 1997 really wasn't that long ago. But, you look at 25, 28 years ago, and the change on stem cell transplants and some of the technology has changed dramatically. And just the comfort level and the amount of research and data with something such a major league thing has come a long way. So that's really interesting, Brett. You got to be on the receiving end of that, which is pretty hard, and you got to be you got to see a lot of it on the patient side, and that's pretty interesting. It motivated you at that young age to say, despite all the drawbacks or challenges of a medical career, you decided to pursue that. And you obviously have a lot of drive and some academic gifts, and a model of excellence in your family. It sounds like you drove that toward medicine. So, anyway, sorry, continue your story. I just thought that was an interesting commentary that not that many years ago that technology has changed so much.
Yeah, absolutely. Um, but at MD Anderson, there my experience there was that there was a trade-off that had to be made early on, which is, I preferred to be at an institution like MD Anderson and receive world-class healthcare. But unfortunately, the flip side of that is it's not uncommon to be treated like a number. And I did feel like that at MD Anderson.
Because
Everything
there's
is
just so
run.
many, so many of them, right?
Yeah, I mean, most oncologists treat a wide range of cancers. And at MD Anderson, there's, 13 that just do lymphoma. So, it's not a warm and fuzzy place to receive uh, cancer treatment. I'll just put it that way. But I think the trade-off is more than worth it. And the outlier to that was actually my original lymphoma doctor. His name was Jorge Romiguera, and he's retired now, but he was phenomenal. And actually, he was so wonderful that my dad hand wrote him a letter after I was finally in remission, just explaining what role he had in my recovery and everything, and just giving him a lot of credit for the success of my outcome. And from what I heard, he really appreciated that. So,
I'm sure he
um,
did.
yeah, I look back at my MD Anderson days with inspiration. There's no negative thoughts surrounding that. But onward and upward in medical school, I thought I wanted to do emergency medicine. You know, ER was kind of a popular show at the time, which I loved. And my research was pointed toward hyperbarics as a treatment for acute cardiopulmonary resuscitation, all in the ER realm and department. But that lasted until about 5 days into my third year surgery rotation, where it was very obvious that my personality was that of a surgeon. I just got along, and my personality seemed to mesh with a lot of the general surgeons. But I did have the wherewithal at that time to think I didn't want to work as much as I assumed general surgeons work. I didn't want to work 80 hours a week when I was out and trying to raise a family. So I had kind of made a promise myself not to be a general surgeon. And then I think the last 2 weeks of my 3 month surgery rotation was ENT. And it just seemed to bring everything together. It was, a subspecialty of surgery. You're still mostly a clinic doctor. From what I was told, it's pretty much an 8:30 to 5 type of job. So it was perfect. And the head neck anatomy was very interesting, but it was perfect. It checked all the boxes, so to speak. So third and fourth year, started concentrating on ENT, and then matched in Houston at Baylor College of Medicine. And I liked residency. It was tough. I think the 80-hour work week went into effect my last year. But that didn't really ENT training. I don't think we really got to 80 hours anyway. So, but I liked residency, and got a job with a private practice that we actually rotated with our second year, kind of in the heart of the medical center. And it was the only, actually, when I started, there were two, but not long thereafter, there was only one private practice ENT group in the med center. So we saw a lot of the worried well, as we like to call it. But I will say I'm going to back up a little bit, because during my cancer battle is when I was first introduced to opiates. And, lymphoma for me it wasn't a painful cancer, but I had several biopsies and iliac crest bone marrow biopsies, which don't feel real good. So I was prescribed opiates and took, quite a number of opiates over those 16 months. And they felt pretty good. I remember I actually wrote a memoir about my experience at Anderson. But I remember specifically writing that, a hydrocodone pill felt like 2 or 3 beers. It was a decent little buzz, but it wasn't anything to write home about. It wasn't any sort of euphoric feeling. And when I was not in pain, it never occurred to me to take a pain pill. It wasn't on the radar at all. And I'm sure I left several pills in the bottle, and just threw everything out when everything was said and done, which, if you're a drug addict, that's not something that would ordinarily happen.
No, but it's interesting even at that young age. I mean, people talk about that. Their very first brush with opiates, instead of feeling nausea or feeling nothing other than pain relief, they feel something akin to euphoria. Even if it's not straight up euphoria, they feel just all is well or relaxed or whatever it may be. So you even early on, you could tell your body had that response to it.
Yes.
Which
Yes.
happens to lots of people. It's more physiologic than anything, I think. But
Right. Yeah. I mean, I remember, I think the first or second one I took, I couldn't go to sleep because I was just in such a good mood. And it didn't occur to me until like a week or two later that it was the pain medication that caused that. But even then, it never crossed my mind. Ooh, let me keep taking these pills to get high. It just never occurred to me.
hmm.
But anyway, that was my first introduction to opiates. And during college, I binge drank for LSU games, like a lot of LSU students. But alcohol was never a problem. No other drug up until that point had been a problem. So um, I am not one of these people that always had trouble with alcohol and had to watch myself, that just wasn't the case. But anyway, so started private practice in Houston, started in 2009, I believe, and ramped up extremely quickly because, again, we were the only private practice inside the Texas Medical Center. And my partners were so good about giving me any leftover patients. So I saw most of the walk-ins and I saw a lot of their post-ops and leftover patients. And it only took about 9 months for me to get to about 100% capacity, where I was seeing, 100 patients a week and operating a day and a half a week. And from the very first year, from day one, really, my partners were on me about making sure that I take at least 3 to 4 weeks of vacation during the year. Consider taking at least a half day off every week, if not a full day off every week, or 2 half days. So what I eventually became, which was, I guess you could call it a workaholic, was, despite my partner's advice to the contrary. So that was definitely all on me.
I mean, that's quite a blessing. A lot of times people start their practice, and whether it be from employers or others, get pressure to see more and more and more and be more and more available. So that's pretty unique, actually, that in your early days, you had mentors that were trying to coach you into a little bit more balanced life. That's kind of unique in some ways, actually. It's cool that you had that.
Yeah, I mean, my partners were absolutely wonderful. For on the one hand, letting me see all their overflow patients and walk-in patients, and then while also encouraging me to have a nice, personal life work balance. So great partners. But I would say for the first 5 or 6 years of private practice, I was literally living the dream, which is something that a lot of people say, but it was the case for me. I loved work, absolutely loved waking up in the morning and going to work. Was married. My wife and I had 2 beautiful, healthy children. So everything was as perfect as you can get. And sometime during year 5, I started to get bored, or what I thought was boredom. And so what had happened was that I had been climbing, I mean, like a lot of doctors, I had been climbing this mountain for my entire life. I had been crawling and scraping and crying and bleeding and sweating and working and sacrificing everything, med school, residency, to get to where I was. And I absolutely loved where I was. But instead of pausing and looking around and kind of taking it all in and enjoying the present time, my only thought was, okay, well, what's the next challenge? What else can we do? What kind of goal can I set for myself? At no point in time did I allow myself to relax and to enjoy the moment, which that coupled with what I thought was boredom at the time, it was actually a lack of fulfillment. But what I thought was boredom, that was the beginning of my burnout. And so during I think it was year 6, so this is around 2015, 2016, it was a Friday afternoon, just like any day. And my usual routine for Fridays is I would get off after half day, get home about 4 o'clock, and my wife and I would sit out by the pool, and I would crack open a couple of Bud Light Limes and have a few beers and start my weekend. But this Friday, I was seeing my last few patients, and in walks a drug rep that had some hydrocodone-based cough medicine samples with her. And as soon as I saw that medication, my first thought was remembering, oh man, I really kind of liked hydrocodone back in the day when I was, across the street at MD Anderson fighting cancer. And so I thought to myself, why don't we just take one of those cough medicine samples this afternoon and substitute it for the 2 Bud Light Limes and see how that goes. And that was it. I went home, took the cough medicine sample, and it was without a doubt the best, most euphoric feeling I'd ever felt in my entire life by a long shot. It was nothing like I remembered it. It was not just a little buzz here and there. It was earth-shattering the way that medication made me feel. And so something had changed. My emotional state was such, or mental state was such, that there was a void that needed to be filled, and hydrocodone filled it. And there's no doubt about it. But needless to say, that decision eventually sparked a 6 year, 5 or 6 year journey into, like the bottom depths of the disease of addiction. And obviously, when I started, I didn't foresee that happening. People talk about addiction being a disease or a choice. The very first time I took it was a choice, and it could definitely be argued that everyone after that was not. But it took me about 2 years to get to where I was using opiates every day. It was a very, very, very slow ramp up. Once a week, twice a week, 3 times a week, just on the weekends. Hey, I'll do it, but not when I'm on call. Okay, I'll do it when I'm on call. I probably won't get called in, but I won't do it when I'm working. That all progressed until I was having to take opiates every day, all day, just to stave off withdrawal symptoms, and working full time and doing well. I honestly believed from week one of taking in those cough medicine samples that opiates made me a better doctor, a better surgeon. I was convinced I was a better husband, better son, better spouse. It just put me in a permanent good mood. It functioned like caffeine for me. It gave me energy and it gave me motivation. It's almost like it was hitting those dopamine, the D3 receptor. I was more motivated and happy than I'd ever been. And the mental gymnastics that I had to do to justify taking these opiates every day while treating patients in the clinic, in the operating room, those mental gymnastics know no bounds. But because again, I truly believed I was better for it.
Man, like it's just to kind of reflect on that for a minute, Brett. Here, we we prescribe narcotics to post-operative patients and other things all the time. But I thought your comment that was interesting. You had a previous experience with it during your cancer treatment, but you didn't go down the addiction cycle at that point. And it was only when you kind of matched the emotional state plus your kind of physiologic susceptibility to that disease that it led to this whole decline. And then most people who have addictions, in my observation, have this sort of narrative that people have to tell themselves, and it really, most of it's not based on reality, but whether it be alcohol or narcotics or whatever it may be, people tell themselves things that aren't true, to whether it be to justify or just, I think it's almost like it's part of the disease process. Your brain has to tell yourself it's okay. I'm better for it. But it's kind of a cautionary tale to all of us, that prescribe medications and those of everybody that has surgery and gets, access to no opiates. You can fall down. Even someone like you, Brett, highly educated, you knew the potential pitfalls of opiates. You knew all this stuff couldn't really be the reality, and yet your brain said yes. Your brain said it's okay. I'm above all that. And how did you kind of walk that walk? In one sense, your professional side says, hey, this is not okay, but your brain says, but I'm so much better for it. How did you navigate those waters?
Yeah, that's a good question, and I'm gonna speak on something that I almost never talk about, but I have to believe that any physician listening to this is going to be wondering how I procured opiates to such a degree that I could take them throughout the day, Monday through Friday, and on the weekends. And so, um, I instituted kind of a policy where I would have my surgical patients bring in their pain medication after they were out of the pain window, and we would throw it away. There was a peripheral family member of mine who got addicted to opiates after a knee surgery because a year after the knee surgery, he went to take some ibuprofen for some minor injury, and he noticed he had some hydrocodone left over, and took that one day, and that led in down into a heroin addiction, actually. So I was thinking to myself, and this started legitimately and for a legitimate cause. I started having patients bring in their leftover pain medication, and then we would deposit it in the lab sink or throw it away so that they wouldn't have leftover pain medication and kids or whatnot wouldn't have access to it. I started that prior to my experience with the cough medicine samples, but eventually I started using that as a source of opiates myself. So instead of throwing them away, or I would throw them away and then come back in the trash can after clinic and get them that way. And so, and it's possible that as my addiction grew stronger, I started prescribing more pain medication than patients might need, just so they would have a lot left over. Um, I I don't remember consciously doing that, but I'm sure I did. I'm sure I did. But ENTs, we do a lot of tonsillectomies and throat surgery, so liquid pain medication is not uncommon. Um, but that's how I procured medication for all those years. And again, I didn't, in terms of the mental gymnastics, I didn't go from being a people pleasing rule follower, which I was, to taking drugs and operating on people overnight. It was a mental process to be able to justify that. But it was an honest jump when I tell you that I truly believe that I was a better doctor and a better surgeon when I was high on opiates. I truly believe that. So it wasn't a far stretch to 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 continue to use them. And then it was obvious, after you start using opiates regularly, the withdrawal symptoms are not far around the corner. I had about a 12-hour window before withdrawal symptoms kicked in. So on the weekends, I had to ration all the medication that I had saved during the week to get me through the weekends. And so preventing withdrawals became the reason in the latter half of my addiction. And that was true. I definitely had to take opiates, and I was a better surgeon because I wouldn't be in full-blown opiate
Right,
withdrawal.
right. The first one was kind of probably more self-deception. The second one was real. If you didn't have it, you would be shaky and in withdrawal symptoms, and so yeah, for sure you would have physiologic problems, but when you were trying to operate. Man,
Yeah.
Brett, it's like this tragic, horrible, sad story, and I appreciate you sharing it. So how did it finally come to light that this was happening, and how did you get help? Because obviously this was leading to crisis, and it can't go anywhere but crisis when somebody's on that path.
Yeah. Well, unbeknownst to me, the DEA had flagged me as a provider just because I was prescribing a lot of pain medication, and they were all legitimate. I mean, every prescription I ever wrote was electronic and was for patients that needed surgery. So I wasn't prescribing to non-surgical patients. I wasn't prescribing to friends or family or myself or anything like that. But there was a flag under my DEA number just because of the sheer volume of pain medication that I was prescribing. So that was going on without my knowledge. Uh, and at the same time, someone, and I never figured out or learned who it was, someone was using my DEA number to buy narcotics wholesale. And to do what with, I don't know. But when that came to light, the DEA now was really on their radar. And a patient voiced a concern that they thought that they were in more pain than they should be. And the pharmacist got involved, and they looked at my history, and one thing led to another. And my partners looked at my prescribing history and were convinced that, I was an opiate addict. And they fired
So
me.
the partners looked at it and said the number of pills you're prescribing far exceeds what the rest of us are prescribing. Is that the pattern they noticed?
I just know that they didn't like what they saw when they saw the pattern of pain medication and quantity that I was prescribing. I was
Uh,
operating more than them. Certainly, I was the busiest partner in the practice, so they knew that I would be prescribing more. And so I'm not sure exactly what convinced them of that. But needless to say, they called me into the office on a Friday afternoon, told me that they suspected this was going on and to take a week off. And about a week after that, I received the termination letter in the mail. And to this day, I've not spoken there. My partners have not returned a text or a call or an email or anything since that day. And which, I don't blame them. If I were sitting in their shoes, it's multiple lawsuits waiting to happen, multiple potential lawsuits waiting to happen. Um, I'm sure I don't know how educated they are on addiction, but I'm sure that they thought that I've made a series of poor choices that put them at risk. And so I don't blame them for cutting me off.
Yeah.
But it didn't make it hurt any less. I will
Oh
say
yeah.
that.
Oh, of
I
course. I mean,
mean,
these are your friends and people you've cared for years. But Brett, this is just such a crazy, sad story. What just I know we'll come back to this, but what would you, other than never taking that first narcotic in the first place, what do you think you would have done different if you had the insight and knowledge you have now? In hindsight, what would you have done different to stop that before it got to be to the crisis situation?
yeah, I would. That's a great question with an easy answer, and the answer is to have listened to my partners from day one, which is to take more time off. Um, Now, I did not ever feel stressed at work. I loved work. If anything, going to work was kind of a sanctuary for me. I had by this time I had two teenage kids and just regular life stressors. And so I feel like I had more stress at home than I did at work. But I was certainly a workaholic, as the definition would put it. And so not working as much, having more serious hobbies outside of medicine, away from medicine, spending more time with my family, all that stuff would have prevented this from happening. Because again, from a purely physiological level, um, I wasn't an addict because I had already been exposed to opiates, and my experience was vastly different the second time. So it's kind of for me, again, I can't speak for other people, but for me, it was a perfect storm of uh, negative emotions and the importance of numbing those negative emotions so that I could live life on life's terms. So it was a combination of several factors that led me from being a one-time opiate user to a full-blown opiate addict.
Man, well, so I know you've been so kind to share your story here, Brett, and it's a really personal story, obviously very painful that parts of it. So, how did you proceed next? Obviously, I mean, you lost your job, the DEA's onto you. What came next, and how did you navigate that next step?
Yeah, well, so about 12 days after I was told to go home, I'm at home by myself. My kids are at school. My wife is grocery shopping. I hear a knock at the door. Go open the door, and there are five DEA agents, um, two of which were in suits, three of which were in bulletproof vests with machine guns. And there was two units across the street with their lights on, two units in my front yard. And I was like, guys, can we bring this down just a notch or two? Because they thought I was running a drug empire out of my house. That's when I learned that someone was using my DEA number to procure narcotics wholesale. They thought they were going to walk into the suburban house and see boxes of narcotics everywhere, and I don't know, people counting money in the corner. I don't know what they thought, but instead they were tripping over dog toys and kids toys. And while they're at home, my wife comes home from grocery shopping with bags of groceries. And so it was obvious right off the bat that what they thought was going on was not going on.
Because you were not at
Um,
that point aware of somebody having used your number.
Correct, correct. And so they asked me, they said, how long have you been writing? How long have you been buying narcotics wholesale? So they just assumed it was me. They were 100% positive it was me, but I had no idea what they were talking about. But um, I was an addict, and without that visit, I might have never gone and gotten well. So even that kind of misunderstanding, I consider a blessing at this point. So I got fired in 2019. I went to rehab in 2020, right in the middle of COVID, at the height of COVID. I went to a 90-day rehab facility in northern Louisiana from July through September of 2020.
How did your wife take it?
She was great. I mean, she was obviously she was shocked and disappointed and frustrating in the beginning. Um, but by the time I was going to rehab, she was 100% supportive. My family was 100% supportive. My kids were supportive. I had a lot of family and friend support, when I went to rehabilitation, which was a phenomenal experience for me. I don't think anybody considers rehab to be fun by any means, but I learned so much about myself. I learned why I do things, character defects, character positives. And I learned that addiction, the drug or alcohol or behavior, whatever someone is addicted to, starts as a solution to something. And in my case, it was a solution because it numbed my negative emotions of anxiety, depression, and symptoms of burnout. And so, in order to prevent that addiction from recurring, you've got to replace the drug with healthy coping mechanisms and stress management skills. And I couldn't learn healthy coping mechanisms until I learned why I do certain things. For example, I've got some narcissistic tendencies. I'm not a narcissist, but knowing what motivates you to do certain things is invaluable if your goal is to turn your life around and get yourself off of opiates. So, I enjoyed my rehab
Yeah.
time.
Well, it sounds like a very humbling, introspective experience for you to kind of reflect on all that stuff. So when you came out of rehab, you've got all these legal things. I know on your stuff, you've shared that you were able to go back to get your license fully reinstated and remain off of opiates and get back into medical practice. So my question is, how did you do that? And how supportive was the medical system? And then with that, as you were able to actually return back to life, how did you stay away from opiates? Because I've noticed that with my patients who've been down that path. It's a real challenge to go back to real life because they know how to get them. Opiates are accessible, and it's hard to stay away from that trap. So I'm curious about those two parts of your story.
Yeah. So I lost my job in 2019, rehab in 2020. I did not go back to work until 2023. And by the time I went back to work, I had been out of work for exactly 4 years. And I will tell you, I mean, addiction is tough and recovery is even tougher. But for me, being out of work for 4 years trumped all of that, especially during COVID. The isolation was almost unbearable. And I was just a complete lack of fulfillment and depression during that time. And so luckily, well, maybe not luckily, but as it happened, I was going through recovery. So I was doing that one day at a time. So I was taking care of my mental health one day at a time as well. Um, and I was heavily monitored and involved with the Texas State Medical Board. So, all the hoops that you have to jump through with that, as well as the board in Louisiana. I could talk for 6 hours about my experience with the PHP in Texas and the medical boards, but I'll just say that my experience with those agencies was incredibly negative. They were not helpful. They were not my friend. Um, and this is even knowing that I acknowledge that their prime responsibility is to protect the public. It's not to get Dr. Cordes back to work. It's not to be Dr. Cordes's friend. I realize that. But two things can be true at the same time. You can protect the public and you can also treat the doctors fairly. So I'll just say that my experience was a negative one with those agencies. But went back to work in 2023.
In the state of Texas?
No, in Louisiana.
In Louisiana, okay.
So my license suspension was lifted in Texas in 2022. It was supposed to be suspended for a year but because of COVID and some other inefficiencies, it was suspended for 2.5 years. But my Texas license was fully reinstated. I moved to Louisiana because that's where we're from,
Right.
and got a Louisiana license with some corollaries on there, and I was on a probationary period. But yeah, an old fraternity brother of mine gave me an opportunity to work in his group, which I am just incredibly humbled and grateful for. I signed a 1 year contract to
In
work with this group.
otolaryngology, right? Back in ENT.
Yes, back in ENT. It was a practice based in Southern Louisiana, and signed a 1 year contract. During that year, their practice was purchased by a private equity group, and the new group that came in probably saw my background and decided very quickly that they weren't going to renew my contract. So, but it worked out because about halfway through my year of working, I realized, and this was despite all my efforts to the contrary, but I realized that I had fallen out of love with clinical practice. I liked it. I absolutely loved meeting and fostering relationships with patients. That was always my favorite part of working as a physician and surgeon. But I had lost my passion for clinical medicine. And so my contract not being renewed was just what I needed to make a career pivot. And, I just happened to come across the industry of life coaching during this time. I had reconnected with a resident that I trained with, 15 years previous to this. And she was in the process of quitting her ENT job to become a full-time life coach. She coaches surgeons out of, anxiety, depression, imposter syndrome, leadership skills, and whatnot. And we had been talking, and she had noticed and asked me where the language that I was using was coming from, because I received a lot of cognitive behavioral psychotherapy and rehab, and was extremely interested in that stuff. So I had continued to read on my own. So I was coming from a place of recovery. It was recovery language to me, but it just so happens that it's also the similar type cognitive behavioral therapy that life coaches use. And she suggested, hey, I think you'd be a good coach, And so I kind of was thinking, what can I do if I'm not a doctor? That's the only thing on my resume. I know how to doctor. I don't really know how to. I know how to cut grass. I know how to throw a disc and disc golf. I
Yeah,
don't
disc
really know how
golf.
to do anything else. And so coaching docs that identifies having symptoms of burnout, especially if they have experience with substance abuse, that became my new passion. And it was nice to feel passionate about my professional life again. So that pretty much gets me to where we are today.
Man, Brett, again, I appreciate your honest and humble presentation of them. I mean, this is something that you might read about or something like that, but you went through it. It's your lived experience, and I wouldn't wish that experience on anybody, because I've had patients who've gone through opiate addiction, and you've obviously gone through it yourself, and it might start off okay, but it always leads to a horrible, awful crisis. And so I'm so thankful that, number one, you lived through it, because that's an
Mm.
outcome. A lot of people die from that type of experience. And then number two, that you've been able to come out the other side and still say, okay, I've still got those core things in my life. It sounds like you still got your family, you've got your motivation, you've got your health. You'll be able to go on and do great things with it. But man, what a crazy experience. And again, I just want to express gratitude for you for sharing this with me, but also with our medical community, for listeners to this podcast who may be experiencing opiate or other addictions themselves, or be working in that realm. I'll tell you, from just listening here, Brett, it just kind of reinforces in my mind the caution we should all we should all use when it comes to prescribing narcotics, because it certainly has its place for postoperative pain. But it's a real challenge when patients, especially those who are kind of experiencing a lot of psychological distress, want to stay on narcotics, because it's very easy to become addicted to it.
Yeah, yeah, absolutely. And if I may, I I do have kind of a feel good sub story in all of this.
Yeah, I'm interested in a story on that. What you've told us your story. What are some other stories along the way?
Yeah. So, it's a story that ties my experience with cancer with addiction in some ways. But anyway, so um, I think I was a chief resident in ENT. So this is my fifth year of ENT training at Baylor in Houston, and so we rotated at MD Anderson for 3 months during our fourth year and 3 months during our fifth year. And so I was finishing up 6 months of rotating on the head and neck surgical service at MD Anderson. Um, this would have been in uh, August or September of 2008. And we receive a consult for a nosebleed in the ICU, go see the patient, and it's Dr. Romagera's patient, my old, lymphoma doctor. And so I took care of the patient in the ICU, got his nosebleed under control, and instead of calling, I decided I'd go visit Dr. Romagera personally, just to tell him about his patient and also just to say hello. I hadn't been to see him in at least 3 years. At that time I was going every 3 years, but I find him in his office, and I presented myself. I just said, "Hey, I'm Dr. Cordes with the head and neck team. I just saw Mr. Johnson in the ICU, took care of his nosebleed. And, I thank you for the consult, and also thank you for saving my life." And he kind of looked up, and, that was not something he was prepared to hear. And he looked up and he looked at me, and I could tell he recognized me, but he did not know where from. And he looked back down, and he got up from his desk and walked over to his bookshelf. And he had my dad's letter, that handwritten letter that my dad had written him so many years before, displayed on his
Oh, really? He had
bookshelf.
kept it special right there. Wow.
Yeah. And so he came over to me and said, I get emotional thinking about it. But anyway, how much he appreciated that letter that my dad wrote. And there were fellows in the room too, but there were some tears. There were some tears in there that weren't mine. Let me put it that way. It was a beautiful moment. But anyway, that was kind of a heartwarming part of my training that tied those experiences together.
No, thank you for sharing that. I, when we go into medicine, every one of us, we're motivated to help people, and sometimes you don't hear about it, but you can tell that letter from your dad meant a lot to him. And I've made it a policy in my practice. I keep every thank you letter I ever get. Not everybody sends a thank you letter. Not everybody says thank you. Some people are really difficult to deal with. But every time somebody takes the time to sit down and write a letter for me, I've got a little file box and I keep every one of them because it means a lot to me. And it's not because I need someone to like give me kudos about what a great doctor you are, but I think, okay, in all the storms and all the challenges and all the middle of the night things that you do as a doctor, what really makes the biggest difference is how did I help this fellow human being on their journey. And certainly, Brett, in your experience, you helped lots of people on their journey, and I think that's what you're basically telling me now is even after this awful experience with narcotic addiction, your goal is to still help people. You started this addiction recovery coaching, and tell me, I think it's called the Burnout Doc, right?
Yes, yes. My website is yes, theburnout.com. And I'm on Facebook and Instagram and LinkedIn. But yeah, I mean, again, like I was saying, I knew how to doctor, and I had experience with addiction and burnout. And I've been training to get certified in life coaching. So I just kind of combined all my abilities, and coaching docs out of burnout was a calling, really. I mean, I consider it a calling, and it's nice to be passionate about it.
Well, and physicians do have transferable skills. Like you say, you know how to mow the lawn and play disc golf, but you also know how to talk to people. You know how to synthesize information. You know how to read something critically. You know how to look at information and decide whether it's true or false. I mean, there's a lot of things with a little bit of extra training, a person can adapt, pivot, modify what they're doing. And it sounds like that's exactly what you're doing. And I think this is a pretty important story. We talk in this podcast a lot about physicians who do cool things and who are inspirational. And I don't want anybody to be inspired to go use opiates and have this experience. Brett wouldn't either. But we want to say, look, you can come from wherever you are and start there and grow. And if you happen to be in the narcotic addiction, if someone listening to this is feeling like they're trapped, listen to the story of Brett's. You probably don't have to go down. You don't have to have the DEA show up with a SWAT team at your house, to necessarily make that change. But a person can change, and opiate addiction's real hard. But you've done it, Brett. And for most people who are addictions, it's an ongoing thing. They have to fight a little bit every day. And I'm assuming you're probably in the same boat where you have to make that decision every single day.
Absolutely. Yep. One day at a time.
Yeah. Well, so Brett, what other things would you highlight for our audience? Any other tips or advice or insights that you'd want to share with our group?
Yeah. Symptoms of burnout. I have signs and symptoms of burnout and other resources on my website. But what I would like to, I guess, leave the listener with is to maximize time off of work in hopes of avoiding burnout. Be passionate about a hobby or something outside of medicine. Again, that helps stave off burnout. But my first symptom of burnout was boredom, and again, that was a misinterpretation with what was actually a lack of fulfillment. But boredom, lack of fulfillment, irritability, feeling angry all the time, feeling frustrated all the time. Those are all symptoms of burnout. But when those negative symptoms leak into your personal life and you're waking up on Saturday and Sunday with thoughts of having to do a peer-to-peer for insurance purposes the next day, you're pretty deep into burnout. And so, there are very limited resources, unfortunately, for physicians who are burned out, or to reach out for mental health challenges in general for docs. But anyway, that's what I'm doing now. So if you have, even if you have questions, hit me up on my website and I'll be happy to get with you.
Man, Brett, thank you again for taking the time to do this. It's got to be, introspective and maybe a little bit challenging. It's a moment of vulnerability to have to share, but it's so meaningful when people do that. And Brett, I really appreciate you taking the time to do this, and hope you'll stay in touch. I'm confident this episode will be useful for listeners, maybe for themselves or family members or others who are going through this. And there is life after opiate addiction. It takes a lot of work, but you can do it.
Yeah. Thanks for having me.
Yeah, thanks, Brett. You keep in touch. Thank you so much.
Okay.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.